with the top 5th percentile earning more than $1 million annually. And then this one in New York, who is working 40 hours a week, is earning over $1 million a year, which is absolutely insane. Medical training is long and expensive, and I get tons of questions from you guys asking if the salaries are worth the years and years of training. Today we're going to explore how much doctors actually make and the different variables that contribute towards your earnings. For those of you guys who are new here, my name is Sean Anderson and I'm a second-year anesthesiology resident in San Diego, California. Let's jump right in. So here I am on MaritHealth.com, which is actually an anonymous salary sharing website for healthcare professionals. All the data here is self-reported from real healthcare professionals and includes things like PTO, vacation time, benefits, bonuses, even things like call schedules. So let's start off with one of the biggest factors that determines your earning potential as a doctor, which is your choice of specialty. So let's look up family medicine and see what the average annual income is for family medicine physicians in the United States. As you can see, the average is about $301,000 per year. What's nice about Marit is you don't just see the average, but you also see the various percentiles. So you can see on the bottom end, family medicine physicians are earning closer to $200,000, but then the top 5% are earning more than $400,000 per year. Now, family medicine requires 3 years of residency. So this is your salary after finishing 4 years of undergrad, 4 years of medical school, and then 3 years of residency. But now let's go to another specialty like anesthesiology. As you guys can see, the average anesthesiology salary in the United States is about $540,000, and this is after 4 years of residency training. Now the high and low end for anesthesiology is much more broad than family medicine. As you can see on the lower side, anesthesiologists are earning still close to $400,000 per year, but on the top percentiles, they're actually able to earn more than $750,000 a year. But what if you wanted to stay in residency for 5 years and do something like orthopedic surgery? Then your average salary is actually over $700,000 a year, which is pretty nice, might I say. But the longest residency is actually neurosurgery. And the average annual income for neurosurgeons after 7 years of residency training is $876,000 a year, with the top 5th percentile earning more than $1 million annually. Now, like I said, I really like that Marit has the different salary percentiles on here because you can really see the intra-specialty variance. So for example, for family medicine, the difference between the top earners and the bottom earners is about $200,000 per year, whereas for neurosurgery, the difference is like $800,000 per year. But again, averages don't tell the whole story, and within specialties, you really have to look at the salary floors and the salary ceilings, because then you'll realize that some specialties that conventionally earn less might be able to out-earn specialties that tend to earn more. Now, subspecializing through things like fellowship can increase your annual earning potential, with the trade-off being that you have to spend another 1 to 3 years in training. For example, if we scroll down on the neurosurgery page to subspecialties, you can see that people who do an extra year of neurospine fellowship on top of their neurosurgery residency will have an average earning potential of $1 million a year. I think one of the best examples to look at is actually internal medicine. So you can see that the average internist salary in the United States is about $300,000 per year. But let's say that you decide to finish internal medicine residency and do 3 years of cardiology fellowship, then your average earning potential is actually $585,000 per year as a cardiologist. But let's say you decide to do another 1 to 2 years of training after your cardiology fellowship to become an interventional cardiologist. We can scroll down and see that the average salary for interventional cardiologists in the United States is actually $716,000 per year. This is why I think internal medicine is a really good example of the way that your salary can increase with the training, because internal medicine has the most amount of paths coming out of it, and all of those subspecialties have such different earning potentials. But let's take a look at my specialty, which is anesthesiology. Like I already said, the average income for anesthesiologists is about $540,000, but let's say I decided to subspecialize in critical care. My annual earning potential is still only about $540,000 after doing another year of training. But if we look at, let's say, OB anesthesiology, you actually earn less on average per year than if you just did anesthesiology, like main OR stuff. Your day-to-day work might look different, but if you're looking at this from a purely financial perspective, it kind of doesn't make sense to do more training after your anesthesiology residency. So if you are thinking about subspecializing, these are are really good factors to consider. Now, when you're wondering if all this training is worth it, you're not just thinking about the years in training, you're also thinking about what your average amount of work hours looks like. So for example, if we look up psychiatry, psychiatrists earn about $340,000 per year, and on average, they're working about 40 hours per week. But like we've already looked at neurosurgery, these guys are earning a lot more money, but they're also working 56 hours per week on average, which over the course of a month adds up to them working 64 hours more than the psychiatrist. If you multiply that over the course of a year and over someone's entire career, you can see how that really adds up. And the neurosurgeon, yes, they're making more money, but they're spending a lot more of their life working. Depending on you and your goals, that may not be worth it to you just for the extra income. But even what you spend your hours doing can vary depending on the kind of contracts you take. So let's look at psychiatry, for example. This psychiatrist is working an average of 45 hours per week, but you can see their responsibilities vary. So for example, they're actually only spending a fourth of their time doing clinical work, and the rest of it is split up between leadership and teaching, where they're actually spending 65% of their time on things related to leadership. So I'm guessing that they're probably like a program director or something. And then they're spending a tenth of their time teaching, probably residents and medical students, or doing some sort of guest lectures. You can also see that they have to take calls. So they have a 1 to 7 call schedule versus other psychiatrists might not take any call at all. This is a good segue into the next factor, which is academic versus non-academic. So if you're in academics, you're typically working at a big university teaching hospital and spending a lot of your time teaching medical students and residents. So for example, if you're an internist, you're not just walking around the hospital doing your rounds by yourself, you're also teaching your residents and your medical students pretty much with every single patient. And that can add a lot of time to your schedule. The patients that doctors see at academic centers also tend to be more complex, which means that these patients typically require more time, more resources, and so academic physicians tend to see less patients on average compared to private practice. In addition to that, academic centers tend to have more patients on things like Medicare and Medicaid, which actually have lower reimbursement rates, and so those physicians might make less money. There's also an academic tax where funding at these programs tends to go towards things like the residency programs and research. So if seeing patients is the most profitable thing a doctor can do, you can see how at an academic center, if they are seeing less patients, they're gonna have a lower income potential. On the other hand, if you're working in private practice and you're not working at an academic institution, you can spend a lot more of your time and energy just seeing patients and doing what you were trained to do. And because the patients tend to be less complex, you can see a lot more of them. And you can take advantage of productivity-based bonuses. So as a result, private practice physicians tend to make more money than their academic counterparts. But this really comes down to preference. Some people really like to teach and like having that collaborative environment and training the next generation of providers, and other people just like to be able to do their own thing. And honestly, both are great career paths. So let's look at some actual numbers. If we go to the anesthesiology page of Marit and scroll down to the academic versus non-academic section, you can see that the academic anesthesiologists make about $522,000 on average, and the non-academic private practice anesthesiologists make $545,000 on average. Now this really isn't that big of a difference, but if you go over to orthopedic surgery, the difference is much more pronounced, where the academic orthopedic surgeons are making $660,000 per year on average, but the non-academic surgeons are making $778,000 on average. So depending on your specialty, the difference between doing academic and non-academic can be the difference of hundreds of thousands of dollars per year. Now, one of the biggest factors that we haven't talked about yet is actually geographic location. Your salary can vary significantly depending on where you choose to work. So if we look at plastic surgery, for example, you can see that this plastic surgeon in the DC metro area is earning $575,000 per year, working 50 hours per week on average. But this plastic surgeon in a metro area in Michigan, who's also working 50 hours per week, is earning almost $100,000 more per year. And then this one in New York, who is working 40 hours a week, is earning over $1 million a year, which is absolutely insane. So you think big city, more money, but that's not always true. So for example, if we look at family medicine hospitalists, you can see that this hospitalist working in rural South Carolina is earning $675,000 per year, and that's more than this family medicine hospitalist in LA that's earning $470,000 a year. So again, big city doesn't always mean more pay. It really depends on the specialty too. A lot of these rural areas are in huge demand for physicians, and so contracts typically are willing to pay more to get those physicians out there. So again, you really want to consider where you actually want to live, as well as what your income income is going to be relative to the cost of living in that area. Now, there are other things to consider, such as signing bonuses, productivity bonuses, loan repayment. So here's an orthopedic surgeon that is working in Maine, and their annual income is about $830,000 per year. And as you can see here, their base salary is actually $580,000 per year, but they're earning $72 per RVU. So their salary model includes a base salary as well as a productivity bonus. And if you look down here, this physician also earned a one-time signing bonus of $65,000 per year, which signing bonuses are very common for physicians. And I definitely recommend you look at what you're being offered as a sign-on bonus. They also received a relocation expense of $10,000, which is really nice because if you're gonna move to another state and city to work, it is really nice that the employer is actually giving you funds for that relocation. You guys can actually check out my video where I broke down my expenses for moving for residency, because that's probably pretty similar to the kind of expenses you're gonna have if you're moving somewhere for a job as a physician. And then lastly, you can see that this orthopedic surgeon was actually given a loan assistance of $20,000. So all of these things really do add up. And again, I really like that Marit captures all of this data, because if you just look up the average salaries of these specialties on Google, you really don't get the full picture. Now, some of the other benefits that are going to vary vastly between contracts are things like PTO, insurance, your retirement benefits, even your continuing medical education allowance can differ depending on the contract you take. You also want to look at if your employer is going to cover your malpractice insurance, or if you're going to have to pay that out of pocket, which a lot of per diem contracts, for example, will require you to pay your own malpractice. Now, depending on the specialty that you go into, your malpractice insurance will also vary. So for example, general practitioners have a malpractice insurance of about $7,500 to $10,000 per year, whereas surgeons can range from $30,000 to $50,000 per year. But OB-GYNs have actually the highest malpractice insurance costs, and theirs can be upwards of $200,000 a year. Now that depends on the location and other factors as well, but you guys get the idea. So is becoming a doctor worth it financially? Well, it depends, but with the right specialty, the right location and setting, and resources like Marit, you can make an informed decision that's best for you. Now, I want to give a shout out here to Marit, because not only are they sponsoring this video, but they really are an incredible resource to both physicians and other healthcare providers. Marit was actually created by physicians. It was created by an anesthesiologist who was on a mission to democratize salary transparency. So it was literally created by clinicians for clinicians. It's free and always will be. There's no subscriptions, no paywalls, and all the data comes from verified clinicians. And it's completely anonymous. So if you're a clinician, I highly recommend that you contribute your own salary data as well. It helps you not only benchmark your own pay against what your peers are making, but also see what's possible in terms of the range you can earn depending on the setting, compensation model, hours, etc. Whether you're in training, negotiating your first contract, or really just curious about what other people in your field are making, I recommend that you check out Marit. And again, if you're already practicing, I recommend that you submit your own data. It's really quick, takes about 2 minutes, and it really helps bring more transparency into the field. And Marit actually has some cool features coming soon that can help you land your next job. I'm really excited about what Marit is doing and what they're planning for the future, so make sure you follow along so you don't miss out. That's all I've got for today. If you guys found this video helpful, make sure to drop a like and let me know in the comment section below if you think that the salary is worth becoming a physician. Anyway, thank you so much for watching, and huge shout out to Marit for teaming up with me for this video. Make sure to like, comment, subscribe, and I will see you guys next time.